lateral sinus lifting. But when do we do each? When do we do the Crestal? I mentioned to you before that Crestal is more for single implants. Lateral is more for multiple implants. Is there more to it? Is there more knowledge that I can share with you? Definitely. I don't want you to have dilemmas. Okay, so the Crestal through the Crest using osteotomes. Lateral using piezo surgery, sinus curettes, and handpieces. These are the two ways to lift. It's important to know that both are equally successful. It's not that the Crestal is more and the lateral is less, or vice versa. Both are equally successful. Why? Because sinus lifting is successful. Why is that so successful? Because you are set up for success. You have three great success factors. The graft is contained. Contained grafts work the best. They're not moving anywhere. They're contained in a specific space. The membrane is basically periosteum. The membrane is a soft tissue layer facing bone. By definition, it's periosteum and it's osteogenic. It's programmed to form bone. Plus, you have great blood supply from the membrane. It's very vascularized. You'll see the bleeding from the sinus. So you have great success factors, and that's why this is a very successful procedure. So what's the difference, and when do we choose each, Crestal versus lateral? So Crestal, generally speaking, is less invasive and less symptoms, period. So anytime that I can, I'm going to choose Crestal. Lateral has more side effects, has more symptoms and risks. Crestal is mostly for single implants. Lateral is for multiple implants and eggshell sinuses. That's when there's no bone, or the floor of the sinus is literally just paper thin. The sinus is pneumatized. It's been devoid of teeth for so many years or months, and then there's no bone at all. In Crestal, perforations of the membrane cannot be repaired. In lateral, they can. Okay, I mean, some doctors claim they can repair perforations in a Crestal sinus lift. I can't. I can do all the acrobatics in the world. I'm not going to be successful. In lateral, yeah, you know, if you can see the perforation, you can bypass it, you can repair it. Okay, so you got some, more criteria, more differences between the lateral and the Crestal. Now, your job is to find the least invasive, to create more height for your implant or implants. That's your job. So yeah, I prefer the Crestal, but I'm not going to do a Crestal heroic when there's not enough bone. Actually, it's going to be much more risky. So here's a great case to start. You have enough bone. You have about 8 millimeters of bone. You have a reasonably thick membrane. You can see it. It's about 1 millimeter. You can lift it. Now, what if you get a perf in your first case? Well, if you get a perf, you can still place an 8 millimeter implant as long as you have enough width. Okay, but it'll give you the opportunity to start the experience with sinus lifting. Don't start with, bilateral lateral sinus lifts with no bone, eggshell sinuses. You're setting yourself up for success. My job here is not that just to teach you and empower you and encourage you to do things, but I want you to do it in a safe way, in a way where you stay out of trouble. And I'm going to share with you what sinuses not to treat and stay away from, because they'll just make you not sleep at night. Okay. Here's another type of sinus that has, you can continue here. It has a few millimeters of bone, 5-6 millimeters of bone. It has a very thick membrane. You can probably lift it about 3 millimeters, get the 8 that you need. And as you do a few more of those cases, you can start treating cases where you have, a thinner membrane, as long as it's visible. If it's visible, it's at least 10 millimeters in height. So if you're a beginner, choose cases where the membrane is visible on the scan. If it's not visible, it's probably less than a millimeter in thickness. I want you to be successful, because here's the thing. Many dentists, they have great intentions and they're very conscientious and knowledgeable and very skilled, truthfully. But when they get the first failure on their first case, they feel like sinus lifting is not for me. And maybe it's not for them, but not because you failed in the first case. It's because you didn't do the right case selection, or you didn't follow the right protocol. So that's why I'm sharing with you some cases. So if those cases resonate with you and you have similar cases in your practice, these are the cases to start. Tip number 2 is always start with a Crestal approach. Don't make your first lift a lateral wall. Do a Crestal approach, do at least 5 to 10 of those, get a feel of sinus lifting, get a feel of the sinus, get some, capabilities, get some courage and confidence to do these things, and then move on to the more complicated ones. Now, the tools that you must have for a Crestal sinus lift are osteotomes. These are instruments that have different diameters and they correspond to implant systems. So try to get an osteotome kit either made by the same implant system, or if not, try to get something that is matching and compatible. And don't forget that the maxillary bone can be condensed. It's not cortical bone, it's cancellous bone mostly. It's type 3, type 4 bone. You can, with osteotomes, create your osteotomy very, very carefully. And you see those edges are rounded off, and there are markings that show you exactly where you're at in depth. So when you do your Crestal sinus lift, you can see how far you're going. Now, the osteotomes that you must use, in my recommendation, you should have an offset. Okay, these osteotomes are straight, fully straight. The osteotomes that I recommend using have an offset. Why do you have an offset? Why? Because it's very hard to use a straight osteotome in the posterior maxilla. It has to bypass the upper lip and the lower lip. And if you use an offset, you can tap on one end and get the lift on the other end. So offset is the way to go. Don't let anybody sell you straight osteotomes. So here's the blueprint. This is basically a checklist or a just bullets of how a Crestal sinus lift works. So pay attention. Even if you're not 100% clear, just follow these steps, and then I'm going to show you a case and demonstrate with it.